Cuts and bruises are the most common injuries that occur to us daily, at home, at school, at work, anywhere you can think of. Unfortunately, no family member is exempted from these injuries. Fortunately, these injuries can be treated at home and there's no need to seek further medical attention. Welcome to the First Aider Show. I'm your host, Onyango Daisy Awor. Today, we are talking about cuts and bruises. Joining us in the show is Dr. James Okeyo, who has been a frequent member here, and we are glad to have you again for this show.
Thank you.
Welcome, and thank you for being here.
Thank you.
I noticed that you had, I think it's a scar or something.
A scar?
Yes, on your hand.
Yes, yes.
Can you tell us your experience with that? Was it a bruise or what was it?
It was a bruise.
Can you tell us your experience with your bruise?
It was painful. You know, I stepped on a stone whereby it was a running bridge. So I thought I can jump. So I stepped on a stone, but that stone was slippery. So I fell down and I got a bruise here.
Sorry, and how did you handle that situation, considering you were on a bridge, were you close to home? How did you handle your bruise?
No, I got even some dislocation here. Oh. It was not only a cut. I took a spirit and a cotton wool. I wiped the place because it was a stone. But you know, with a stone, you have to go for tetanus injection. So I went for a tetanus injection and I took some antibiotic.
Does it mean for all cuts or bruises we need to get a tetanus shot?
It depends where, what the object that has caused that cut. But you know, most these open objects, they are rust. So we should not assume because tetanus, have you seen somebody with tetanus?
Not really. We just used to be told in school, I remember there was this locked jaw and you're told that it would be so stiff and you'd die in, I think, the next 10 days. So, you know, it gets very scary.
Yeah, you cannot even swallow. You cannot see light. You have photophobia. You don't want the sound, you know. You are being enclosed, screened somewhere alone. So tetanus is a very dangerous disease.
Scary experience.
Yes.
And since we are talking about bruises and cuts, would you say that that bruise was a wound? Would you classify a bruise or any other bruise as a wound?
Okay, a wound and a cut is a fresh open, but a wound is somewhere, an open cut which has already been infected. Okay. That's a wound.
So how would you know that your cut or your bruise is infected?
You will see maybe the pus, the bleeding, the way it is dirty. So that one can be now, we call it septic wound. Okay. Septic something, oozing, pus. Okay. Yes.
And what are the different types of cuts or maybe bruises?
We have superficial. Bruises are normally superficial. But you know, a cut, it goes deep. And also, a bruise does not bleed more than five minutes. But a cut, you have to stop the blood or through dressing or stitching. Yes. And
since you're saying a cut, you know, it has to bleed and you need to stitch it.
Yes.
Usually when I cut vegetables, I don't like cutting greens because I usually the knife has to go with like a small chunk of my skin. But sometimes there's bleeding, other times it's just the cut, which is usually painful, but sometimes it's not bleeding. Would you classify that as a cut or is that a bruise?
That's a cut.
Okay.
Yes.
So what's the difference between
a bruise? A bruise, you know, you cannot, when a sharp object cuts you, you'll have a cut. You have a deep wound. But a bruise is something, a blind object, and then it is superficial. Just go with the outer layer of
outer
the
layer
skin.
of the skin.
Yes.
And what do we need at home to help us to sort out maybe a cut or a bruise? If someone has a cut or has a bruise, what do we need to maybe disinfect and get to the process of the first aid?
Basically, what we need is spirit, do you know methylated or surgical spirit?
Yes.
And all in all these things are here in our first aid kit. Like this one, this is a surgical what?
Surgical spirit.
Surgical spirit.
Yes.
And this is the best with all these surgical cases. We have methylated spirit, but this one is the best for open wounds. You know,
Okay.
open wounds so you can clean it. And then you can always, you need to have gloves.
Yes.
Yes.
For your own
and I told you,
protection.
for your own protection, we have HIV, hepatitis B. This infection, we can get them from the blood. So you put on your gloves. After putting on, you clean with water. The cut, you have to clean it with clean running water.
Can we
Not-
also use soap? You know, because soap kills germs.
Not necessarily clean with soap, but clean running water. Are you getting my point?
Yes.
With a clean cloth, a sponge cloth, you can maybe, you know, there may be some, so the mud, you fall in the mud, so you clean that place very well. And then we have betadine, iodine. Iodine we have, is here in the iodine. So you can take the iodine, you open it, and then you clean. It is like a disinfector. It prevents also the bacteria not to get into the wound. And then this wound, you can stitch it, you can dress it, or you can leave it open. Depends whether the cut is bleeding or not bleeding.
Okay.
Yes.
Viewers, if you're just joining us, we are talking about cuts and bruises, and we've seen the different cuts and bruises. There's the deep one, and then there's the superficial. You
The
call
superficial
it?
one.
Superficial, yes. The
Yes.
one that occurs just above the top layer of your skin. And we are looking at the things that we need in the house to deal with the cuts and bruises, such
Yeah.
as the surgical spirit, which
Yes.
is the best. And you also need iodine and bandage, right?
Bandage, yes.
So you've talked about leaving it open or dressing it.
Yes.
Does that mean that if I have an open wound and I just leave it open or I dress it, it's okay?
It's
good to
okay.
go?
You know, when you have an open wound, so long as the reason why you do dressing, when this wound, there's a bleeding. So when it's not bleeding, you open it. For, you know, when you tie a bandage, even the free circulation of blood in that area is being, there is no free circulation of blood.
Yeah.
So you find that the healing process does not take place very fast. But when you open the wound, so long as it's not bleeding, it will heal very fast because there will be free flow of air, free flow of blood. And also, so long as you keep this wound very clean.
Speaking of clean, does that mean we need to disinfect it frequently?
Exactly. You need to do cleaning it maybe in the morning. When you are going to sleep, you use iodine.
Is this for both the one where somebody decides maybe I'll just close it or leave it open? Is it exclusively for open wounds or for both open
Even
and
for
closed?
both. For both, you do dressing depending with the magnitude or the size of the wound. There are some wounds whereby you can open after dressing, you open it after 3 days. So long maybe the skin, it's a deep cut. For the skin to come together, you need to have time for the healing, for that the opening to be closed.
Okay.
So you mobilize that area. Yes.
And when there's bleeding, how do we stop the bleeding?
You apply pressure using the gauze, this one. You know when
Plain gauze, or do we put anything on it?
No, plain gauze. I told you you wash the wound, the
Yes,
cut, or
disinfect it.
you disinfect, and then you can stitch, or you can either dress it. But before dressing, you can apply pressure with this one, and you tied it very firm.
This is while it's still bleeding?
Yes.
Okay.
And I'm telling you, after 30 minutes, if you open it, the bleeding will stop. So long as you don't have a problem, maybe disorder of clotting time.
And when we are doing this pressure of to prevent the blood from flowing, there's usually pain with the cuts and the bruises. How do you subsidize the pain?
Pain, you give an analgesic. Yeah, so that's one you give for the pain. You can be injected, you get the orals, but you know, the one, maybe if the pain is severe, you can give IM, intramuscular injection.
What is intramuscular injection?
It is IM. I think I've told you like that.
These terms are big. Explain it a little bit further. So that
intramuscular, there are so many types. We have around 3 types of injection. We have IM, which is intramuscular injection. You inject, you go deep in the muscles, muscles. Are you getting me?
Yes.
Whereby you can inject the buttocks anywhere.
Okay.
And there is somewhere that you need to inject. You don't inject all the area of the buttocks.
Okay.
Yes. Because if you inject like that, you can even inject something called sciatic nerve, and you become paralyzed.
Wow.
So another one, we have intravenous injection.
I've heard of intravenous.
Which is IV.
Yes.
So these are the vein. Venous, we call it vein.
Veins.
Yes. And then another one is subcutaneous. Yes. So most of those people who have diabetes, if they're giving you, inject the insulin, you go like 60%. You don't go to the muscles. You just, are you getting my point?
Yes.
Yes. So those are the types of injection that you can give. We have oral. Yes. We have sublingual, where you put drug below your tongue.
Okay.
You have rectal. You've seen children with high temperature. You insert the what? The drug in the anus. Have you seen it?
No, I have never seen that. That seems very scary.
No.
How do you even make a child do that?
No, there's a drug that you just insert.
Okay. And when we talked about disinfecting a wound and, you know, washing it and under running water.
Yes.
If there's an object in your cut or in your bruise that is not coming out when there's washing, what do you need to do to get that object out of your cut?
That's a very good question. You know, before even you stitch, that's the reason why I told you, you wash the wound first.
Yes.
To confirm whether there is a foreign body inside before stitching. So you have to wash it. If there's a foreign body, you can do local anesthesia. You use, that one is in the hospital, you cannot do it at home. Take this casualty to the hospital, will be put under anesthesia, local anesthesia to remove this object.
Thank you very much. Viewer, we've just learned that if there's a foreign object in your cut or your bruise, please do not remove it by your own hand. Go to the hospital. We are going to take a short break, and when we come right back, we will do a practical example of how to deal with cuts and bruises, and also talk more about cuts and bruises. Stay with us and do not move far away from your remote. Welcome back to the First Aider Show. Today we've been discussing cuts and bruises, and right now we want to do a practical example of how to handle cuts and bruises. Joining us is a casualty who will be used to demonstrate to us what is supposed to be done. And with us is Dr. James Okeyo, who's been our guest throughout this episode, and he's the one who's with all the expertise that is needed for all these things that we are doing. So, Dr. James,
yes,
let's assume our casualty here was maybe cutting grass or something with a panga and cut himself.
Yes.
How are we supposed to handle that?
And he's bleeding.
Yes, he's bleeding.
First of all, you come and pick your gloves. I told you first.
Gloves for safety.
You take care of who?
Of your safety and the safety of
Your safety first.
Yes, your safety first.
So after putting on the gloves, you will take the gauze and then you take the water. Can you bring the spirit? Fortunately, we don't have running water here. So you'll just take this wound, you put it to a running water, running tap.
If we don't have running water near us, what can we use?
If you don't have a running water, you just take a clean water, or there's a water called normal saline in the hospital. You just wash the wound. You wash, very clean. You take surgical spirit, you pour, and then you clean around. And then what you should do, don't clean outside the wound and then you come again.
In the cut?
In the cut.
Okay.
That one is like you are collecting all the germs here. You put them where?
Inside.
So you start inside the cut, coming out. Are you getting my point?
Yes.
You come out. You clean and you come out. You clean and you come, but you change. There are so many gauze there. You don't
So
use only one.
When you use the first one to clean,
Yes.
you dispose it
You
and
dispose
take another
and
one.
take another one.
Okay.
But the best drug is betadine. Betadine, it's always the best because it prevents no bacteria to get in the wound.
And our casualty is bleeding.
Yes.
How do we stop the bleeding?
Stopping bleeding, you can dress it. You can put more pressure and you dress it tightly so that the bleeding can do what? Can stop. If it is a deep cut, maybe you've cut even the vein, you stitch. So this one, maybe you are at home, you don't know how to stitch.
Yeah.
You are not a medical practitioner and all that. You just put maybe a cloth, a clean cloth or towel. You
Tie around.
with pressure.
And
you
what
take
about
this person to the hospital.
using honey or, or even Vaseline to apply on it?
Okay, I've seen so many people, they have been using honey in septic wounds. Okay, it was being used long time ago because, bacteria, they lack sugar. So, when there's a septic wound inside, the bacteria is inside here. So when you apply honey, they will come out to look for what? For
the sugar.
For the sugar. So because of the temperature and the climate outside, they're going to do what? To die. But nowadays we have advanced drugs that we use like antibiotic. Long time ago, getting a very strong, we call it a broad spectrum antibiotic, we could not able to get. So that's the reason why long time ago people used to apply what?
Can
honey.
we still apply honey? Because it worked for them. If I can't get to the hospital in time, can I still use honey?
We can still use honey, but nowadays, getting a natural honey is very difficult and very expensive. So you rather go buy drug than buy honey. But if you have honey, that one is also part of first aid.
What about ice?
Ice,
yes,
you put in a cut.
Or even a bruise.
A bruise?
Yeah.
Not necessarily, because the ice will kill the cells.
Okay.
Yeah, it's not necessary. You just dress the wound or the cut. Yes, but the bruises, a bruise does not bleed. Yes, we just, maybe it has a small bleeding.
Okay.
You just do what? You wipe and clean the place and you leave it open.
Our casualty here was cut with a panga.
Yes.
That means he needs to get the tetanus shot.
Exactly.
And how often or how frequent? Is it every time that you're cut you need to go and get the shot, or how are we supposed to go about that?
No, it's not that every day or every time. If you got a cut, you are being injected. There's some, you can even take 3 years after injection of the tetanus. Yes. Even if you can remember, there are women who, when they are pregnant, they are being given tetanus injection, and you find the child is still secure, even if it has a cut, cannot be given a tetanus because the mother got the injection. Yeah.
So is it the same for kids when they get the shot once? It gives them a leeway, a longer period of protection?
Exactly.
And one more thing. I don't think it's one. I think I still have other questions.
Yes.
How can we help, our kids play all the time, they get these cuts, these bruises when they're out in the playground. How can we help them to avoid getting cuts and bruises when they're playing around?
All in all, it is all about education. Once the child has got a cut, any bruises, after healing, you put the child down and you tell the child about the danger of getting a cut, bruises. Yes, because these cuts, you might get like what the disease that I was telling you, the tetanus.
Yeah.
Yes. So if you avoid, maybe, there's some people, they just take it lightly. When there's a cut and all that, they just leave the child like that. It is not, it is very dangerous.
Okay.
Yes, and also you make your body having so many scars. Yes. These cuts, they normally, if they have not been managed well, they heal with scar.
Okay.
But even like ladies, they don't like scars.
Of course, we need to take care of our beauty and everything.
Yes.
Daktari,
yes.
How long does it take for a bruise and a cut to heal?
It depends with the management, because I told you, when you clean and you dress this wound and you follow the instruction of a doctor and you take antibiotic, this wound will heal very fast. But if you leave it like that open without treatment, it will take long, because it will be infected and you get infection. It become now a septic wound. It can go even to destroy or infect the bones.
And have there been cases where somebody has followed everything that the doctor said, but the wound still did not heal?
Yeah,
maybe the expected time?
People are different because of their immune system. Yeah.
So what can you do in such a situation?
It's about the immune system. So what you can do, you need to just know the cause. If for the immune system, maybe this person is resistant to the drug that you are giving.
Okay.
Yeah, there's so many things that you need.
What about the situation of using salty water to treat the cuts or bruises? Is it healthy? Is it a good thing to do?
Salty water is not, or salt, you apply salt. Have you ever applied salt in a cut?
It is very painful.
It is very
painful.
Yes. So this one sometimes it stops bleeding because of the osmosis. Did you read osmosis?
Yes.
What is osmosis?
The transfer of water.
Osmosis, just there's high concentration. There's an high concentration of salt outside than inside. So you find that they need an equilibrium. So you'll find more of blood or the fluid will come out to make this equilibrium to take place.
To be balanced.
So it's not medically that salt, it is good for the wound you apply. But people are ignorant. People are just doing it out of what? Out of ignorance. Yes.
And one last question.
Yes.
About the bruises. If, us ladies, we don't like having scars and all these things. Is it a good practice to apply makeup to cover up the bruises or our wounds? Is it a good practice? What is the danger of doing that?
The danger, there is no danger, but medicine is very dynamic. Long time ago, you can stitch and then the wound heals with scar. But nowadays, if I want, I can stitch you to cosmetically. To be cosmetic, I can stitch you whereby you cannot know, nobody cannot realize that you had a cut even in your face.
Okay.
Yes, because nowadays we have stitches which are absorbable.
Okay.
Have you heard them? Those people, maybe the people who have been done cesarean section,
Yeah.
they are being done stitched with nylon, which is absorbable. So you cannot remove the stitches. So you can be stitched whereby it is cosmetic. No any mark can be seen.
Thank you very much for all your insights. Viewers, that's all we have for today about cuts and bruises. I hope you've learned a lot and you've learned about the practices that maybe you're doing and were not right, and now you have a new practice to do whenever you have a cut or a bruise. Thank you for joining us today, and we hope to see you next time, same place and same time.